I head the AIDS and Human Rights Research Unit.
And what is the AIDS and Human Rights Research Unit?
It's a unit it's a joint unit between the Center for the Study of AIDS and the Center for Human Rights at the University of Pretoria. And what we do is HIV, AIDS, and human rights work, and sometimes access to justice. We have a paralegal advice center in an area called Amanskraal, which is north of Pretoria, where we do a lot of our access to justice and human rights work.
Okay, I've kind of been given a lot of definitions of what AIDS is. It's kind of become just like an umbrella term. Do you think you can specify it for us and give it like a definite, like what a definite answer of what AIDS is, or is it an umbrella term consisting of so many other diseases?
How we view it at the center is that it is an umbrella term consisting of other diseases because the HIV infection is in 4 stages, and AIDS is the last stage in the infection, and we give 2 definitions for it. The AIDS stage is defined as being HIV positive and your CD4 count being below 350, or being HIV positive and also having opportunistic infections like the PCP pneumonia, which is a pneumonia characteristically associated with HIV/AIDS, or other collections of diseases, or opportunistic infections.
There have been reports of women that have immunity to HIV/AIDS that have been living with it for years. How practical is it to use them to create immune vaccines?
I'm not sure about the practicality, but what I can say is there was research that was done with CAPRISA. CAPRISA it's an organization in Durban. It's a joint organization with UKZN and UWC, which are universities in Pretoria, in South Africa, and another United States university. I forgot what it is. And they were doing trials with I think it was Truvada or Tenofovir, and they found out that within the trial, some of the women had developed some sort of resistance towards the infection. Not necessarily resistance, but what had happened is the virus itself, when it's exposed to the immune system, it starts creating a sugar coating, and there's a specific location where the viruses then become vulnerable, and then it can be sort of killed off. But it's not necessarily killed off in the sense that the virus goes away, but it's just the vulnerability of the virus. So I think they're starting to do trials now to research that specific coating, the sugar coating. I think it's called glycan, and that position in the virus that makes it vulnerable, that weakens it. So I think there's some research happening, but I'm not too sure about the practicalities of how it will work out.
Okay, and so I've been informed that you can take a test in one country or one continent and go to another center, take the test, and you'll get different results. Do you know why that is or how that occurs?
I'm not sure why that is. What I do know is that different continents have different strains of the HIV virus. And in South Africa, in Africa, sub-Saharan Africa, we have the most virulent virus. It's the most dangerous one because it progresses to the HIV/AIDS stage faster. I think it's because of the different strains, and the tests that we use pick up that strain in sub-Saharan Africa, and maybe when you go to another country, it doesn't necessarily pick up that particular strain. Okay. So maybe that could be a possible answer. So
how prevalent is this disease in sub-Saharan Africa?
It is in South Africa. It's a major, one of the major infections, because South Africa, they say, it used to be Botswana, has the highest infection of the virus. Okay. And it affects mostly young people, 15 to 35 age group. So those are the ones who are most affected by the virus. But it's starting to change a bit to the more older groups.
And now why do you think that is? Is it like poor hygiene, sexually transmitted? Like there's various ways you can contract AIDS. Most people see it as a sexually transmitted disease, but we're in AIDS is more prevalent in poor areas, right? Mm-hmm. So do you think that it's more so like the poor living habits that people are more easily contract AIDS, or like what do you think?
In South Africa, what we found is that The social issues are really what drive the
Yeah,
HIV
okay.
epidemic. Some of them being intergenerational sex.
Okay.
Poverty also plays a role. Early sexual debut.
Okay.
Some people don't necessarily, even though they know about HIV, because the
Mhm.
government has done a lot to, to bring out messages about HIV. Some people don't really understand,
Yeah.
what the virus
Mhm.
really does in the body. But it's mostly the social issues that drive the epidemic
Okay.
in the country.
Okay.
Right. The first step to fighting a disease is prevention. How does your center focus on preventing HIV/AIDS?
Our center is a social science center, so we do a lot of social science intervention work. We focus on, we do a combination of individual, social, and structural prevention methods. For example, what we do is we do trainings for students on campus on HIV/AIDS, but not just HIV/AIDS, but general sexual reproductive health and rights. So we educate them about their bodies, their sexuality, and how that can make them vulnerable to contracting the virus, and what they in turn need to do to protect them from the virus. But apart from that, we also offer additional structural interventions, such as we have a clinic on campus where students can go and get an HIV test, get counseling. We have the center where students can, we have support groups at the center where students can come and join the support group if they're HIV infected, and get support from there. So it's on the individual, social, and structural levels that we try and fight HIV. Yeah.
Next question is, how is the government helping you with this?
We don't necessarily work directly with the government. We're an NGO inside the university. So a lot of our work is aligned with what the government does. We try and, improve or add more support to what the government is doing, because the government can't do everything. So we focus on the students and the communities in which they come from, and the government focus on the general country. Yeah.
Are other universities taking this step as well?
Yeah. Most of the universities in South Africa have HIV/AIDS units, because it's under the higher education of South Africa. There's something called Higher Education AIDS, and that's basically a body that helps universities to deal with HIV/AIDS within their institutions. So most of the institutions in South Africa have an HIV/AIDS unit.
You said higher learning, so what about the high schools and other primary education systems?
With the high schools, it's mostly the Department of Basic Education that takes care of that, because they have something called life orientation in schools in their curriculum, and that's where they incorporate HIV/AIDS within their curriculum. As a university, we don't necessarily do a lot of work with high schools, but we have, as the center, we have, for our volunteers, we have a portfolio called Community Outreach, where they go out to high schools closer to the area, and they do HIV/AIDS work there. Maybe one thing that may be different from maybe South Africans here and African Americans is some of the influences on HIV/AIDS in South Africa is culture. And culture plays a huge role amongst Black South Africans. And there are certain cultural practices that do make people vulnerable to HIV and AIDS. But the cultures are different depending on from which ethnic group you're from. So I can't necessarily talk in general about the cultural practices, because it depends on the different ethnic groups. But there are cultural practices that can make people vulnerable to HIV infection. One of them that's been highly contested is the whole virginity testing. That's been virginity testing of young girls, where young girls, maybe they're in a village or maybe in wherever they're from, an elderly lady from the community, checks if the hymen is still intact, and then if the hymen is still intact, then they celebrate it as being virgins. But other people see that as putting the young girls in a vulnerable position, because then they can be targeted by older men who may still hold the belief that having sex with a virgin can cure the virus. It's not very prevalent nowadays, but it's an idea that was there in the beginning when HIV started developing in South Africa. But the fear is that if you do that with young girls, then you may be putting them at a vulnerable risk.
Exactly.
I love working with people, and my interest is with public health and culture, and how culture impacts on public health. And so that's what drives me to work every day, because I am from the Pedi culture, but I didn't necessarily grow I wasn't necessarily raised in that culture. My father raised us a bit differently. We didn't do a lot of cultural things, but I have a lot of people in my life who believe in culture and what culture stands for. And I've seen that, people do practice African medicine and the more westernized medicine. So people use different types of medication or healing, to improve their health. So that's what actually drives me to work every day, getting to know more about people.
Sorry, can you define this term African medicine for those who don't know? And can you compare it to Western medicine?
Okay, so I don't know if in other African cultures, but in South Africa we have people called traditional healers, and they are basically people who get a calling from the ancestors that they need to become healers, and they are guided from the ancestors in healing processes. So if I were to go to a traditional healer with certain ailments, the ancestors would guide them on the types of medication they're supposed to give me. So they use natural medicines, medicines that they get from, plants or whatever, but it's mostly natural medicines, and then that's what they would prescribe to you. But you get different categories of traditional healers. There's those who use herbs, some use, prayers, some use, maybe, what do you call this thing? When you burn something?
Incense?
Incense, yes. So you get different categories of traditional healers, but mostly they're guided by their ancestors on what they should give you to improve your health.
And we know this kind of healing is looked down upon. Why do you think that is so?
It's looked down upon because people don't necessarily understand traditional healing and traditional healers, because it's more spiritual. It's not something, people don't necessarily go to school and they get taught, this is what you do, this is how you do it. And with traditional healers, when you get the calling, some people go to the mountains, and there's a particular elderly traditional healer who tells them how to listen to their ancestors so that they can be guided by their ancestors. And a lot of people don't necessarily believe in that. So that's why it's looked down upon. But the issue is, in South Africa, a lot of them go to traditional healers. I currently started working on a project with traditional healers in Pretoria, in Taurean, and because the research that we found is that almost 80% of South Africans, especially Black South Africans, because they're the majority, when they feel sick, firstly they feel like it's more spiritual. So they would rather go to a traditional healer first than go to a doctor, a Western doctor. So we realized that we need to work with traditional healers, especially when it comes to HIV and AIDS, because sometimes some traditional healers, they may give them medication which maybe the person may not need at that particular moment, that may make them, more sick. But it's not necessarily that the traditional healing is not working, but it's just that we need to educate more traditional healers on how the virus works, so that if if it's not something that they can do themselves, they can transfer the people to the local clinics. Traditional healers are very open to learning, to know, because they, as the same as doctors, their goal is for the best goal is patient care. So they want to do the best for the patient. So what I found is that a lot of traditionalists are very open, because the traditional healers that we're working with, we recruited them to get HIV training so they understand the virus and how it works in the body and how it impacts on immunity, and on how sometimes medication, certain things that people do can make them can weaken their immune system, and the virus can overpower their bodies. So once they know that, the traditional healers are able to work with the clinics, because there are already traditional healers working with local clinics, referring patients to local clinics to get ARVs or to get other types of care. And there are people who use both Western and traditional medicine together. So it's trying to get the balance between the two. It's a bit difficult, it's challenging, but it's something worth doing, because a lot of people use traditional healers.
And you spoke of immunity, and the discoverer of HIV actually said that if you have a strong immune system, your body can fight HIV. So what are your thoughts on that?
That is true. It doesn't necessarily fight it to that the virus is away, because you can never kill a virus. That's why we still have the flu virus, because you can never kill a virus. But when the virus is suppressed, the body has a chance to develop more CD4 cells, which strengthens the immune system. And some people do have undetectable viral loads, but that does not necessarily mean that the virus is away. It just means that the virus has been suppressed to that extent, and the body is able to recover.
What do you say to tell the people that want to take a holistic approach to keep your immune system up?
Well, we tell people, because healing is, we see it as a three-part way. There's the biological, the mental, and the spiritual. So we can't necessarily tell people this is what you do. We can give them information, and then they, in turn, can make the decision on, the information that is given for them. Because we can't discourage people on the types of holistic approach that they need to take when it comes to treatment. Because some people need, the holistic approach as well as the medicine. Maybe that's what will keep them, more alive. Because it's not just about the physical, it's about the spiritual and the mental as well when it comes to healing. What I see for the future of AIDS in South Africa is that people get to hopefully, because I believe that HIV AIDS in South Africa actually came to teach us about a lot of social issues, it's not the virus itself. It's the social issues like the stigma, discrimination, the human rights issues. So, and that's a lot of the work that I do. I hope that what the virus is teaching the people is that it's just a virus at the end of the day. It's a virus, but the social issues that come with the virus, such as the cultural issues and the human rights issues, that's what I feel HIV is teaching us about. And what I hope to see for South Africa is that people live in a more tolerable society, regardless of, your status. And that comes with the social aspects of it. My interest is with women's sexual reproductive health and rights, especially in Africa, and how culture influences that. So I want to do more research in collaboration with other institutions in other African countries. I've already done some work in Kenya, but it was not related to women's sexual rights. It was more with young people and life skills and HIV. So I want to work more with the women's health rights issues.
Any last thoughts?
Any last thoughts? I think that, in order to understand HIV in South Africa, people need to understand the history of South Africa, and maybe you'll understand some of the social issues about South Africa. South Africa comes from, as everybody knows, the apartheid era. And, with that came a lot of social issues that need to be dealt with, like human rights issues, how to talk to your children, culture, and all of that. So in order to understand South Africa, you need to understand it from, understanding the history as well in order to understand the present. And my hope is that people will get to see the continent as a continent, not a country, and that the continent is diverse. There are some commonalities within the African continent, but it is a diverse continent. And, sorry?
It's very diverse.
Yes, it's very diverse in terms of the people, the living situations, the languages, the cultures. So it's a very diverse, and it's a very exciting continent. But the virus, at the end of the day, is supposed to teach us about the social issues that make people more vulnerable to the infection.
And I think it's also important to understand the history of also the disease also.
Yes.
And where it came from.
Yeah.
Well, thank you very much.
It's a pleasure.